Facebook friends. I am Dawn Kimura, and I'm here with Catherine Ross. We are both nurses here at Prisma Health Heart Hospital. I am the program manager for the Chest Pain Center and the Stemi program. We're going to talk to you today about a very important life-saving skill called hands-only CPR. It's 2 important steps, but before we get started, I wanted to really quickly talk to you about, because February is Heart Month, I wanted to talk to you about one of the most important things is prevention of heart disease. And one of the early killers of most Americans in the United States, men and women, is sudden cardiac arrest or chest pain. One of the things that can happen with chest pain and sudden cardiac arrest is you can develop something called a heart attack. And so we're going to talk today about signs and symptoms to prevent that from happening. A heart attack happens when a vessel in your artery gets clogged and you can't get blood flow to your heart, which is a very important muscle you need blood flow for. It can be caused, some of the symptoms that you can have can be chest pain, shortness of breath, sweating, nausea, fatigue. You can have pain in one or both of your arms, or you could have some jaw pain with heart disease. So heart attacks are something that we like to prevent. And what we want to encourage people to do is, if you think you or someone that you love is having any of these symptoms or could possibly be having a heart attack, is to immediately call 911 and get them here to our heart hospital. Here in Columbia, in South Carolina actually, we have one of the only freestanding heart hospitals in South Carolina, and we provide expert care to all patients that are having any type of heart disease, including heart attacks. So we encourage you to dial, don't drive to survive is our slogan. So call 911 right away if you or someone you love you think is having a heart attack. And while you're waiting for 911, if that person suddenly collapsed, because we've all seen that NFL Monday Night Football event where that athlete collapsed on the field and someone immediately rushed to their aid and they actually survived the sudden cardiac event. So I have Catherine here who's going to demonstrate the 2 important steps for doing 911. The first, again, is to call 911. Hey, you, call 911. Hey, you, please go get me an AED. And then Catherine's going to lay her hands on her chest. You're going to go to the center of the chest. You're going to push about 1 inch to 2 inches deep, and you're going to begin compressions immediately. And you want a steady rhythm. Good job, Catherine. You want that beat to be about 100 to 120 beats a minute. You want it to be a consistent rhythm. You want to continue to do CPR until 911 arrives, or someone trained in basic life support arrives and takes over for you, or you get too tired and aren't able to continue to do it, or if the patient wakes up and says, hey, stop, or the victim wakes up and says, hey, stop. While Catherine's doing CPR, I'm going to run over here and get this life-saving device. It's called an AED, or an automated external defibrillator. AED is shorter, that's why we call it that. You want to immediately take out the pads that are on here. There's pictures and diagrams. Turn it on.
Remove clothing from the patient's chest.
And we've done that already.
Apply pads onto patient's bare skin.
There are pictures on the pads to tell you how to apply them. You want to put them on the front of the chest.
Do not touch the patient. Analyzing heart rhythm.
And this is talking to you. It's telling you exactly what to do.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Press the flashing shock button.
So then immediately you're going to press this button. This is universal.
Button. Shock delivered. Begin CPR.
So immediately you want to go back to the chest and start CPR right away. And this machine is actually counting the
10.
The rate of the compressions for you.
20.
Good job. So you want to continue doing those compressions. And that's it. So call 911, push hard and fast in the center of the chest. And hands-only CPR is recommended for young adults and adults. If you want to learn how to do infant or child CPR, I would encourage you to go to prismahealth.org/heart and get community information about community CPR classes in your area. Thank you and have a great day.